Hi, my name is Dr. Jeff Hart Cooper, and I'm a pediatrician as well as the medical director for the virtual PrEP program for adolescents and young adults here at Stanford. I'm excited to share a program with you today. And just to get started, to kind of go over the why behind this program, I just wanted to show this slide. And what this looks at is the lifetime risk of acquiring HIV by transmission group. This was back in 2016. This was through the CDC. And what we see is that that lifetime risk for heterosexual men and women is quite low, right? So less than 1%. But when we look at men who have sex with men or MSM, that lifetime risk is incredibly high. It ranges from around 10% for white MSM up to 50% in African-American MSM. And what we also know is that there is a daily medication that our patients can take to prevent getting HIV. That medication is called PrEP. It's a daily pill. It reduces their risk of sexually acquiring HIV by about 99%. It's safe, it's effective, it's FDA approved, and it has a US PSTF grade A recommendation for HIV prevention. Unfortunately, there's a really significant gap in terms of youth access to PrEP. So this is looking at the percentage of PrEP users that were youth in California and comparing that to the percentage of HIV diagnoses that are youth. And this really highlights this gap that we're seeing in these 13 to 24-year-old patients. And this gap is something that our program really seeks to fill by improving access. And that's why we created the program, is really just to improve access to quality PrEP care for adolescents and young adults in California. And we do this through a variety of ways. First of all, from a PrEP awareness perspective, you have to know that this is not a part of routine sexual education. It was only recently FDA approved for youth, and a lot of providers are not trained to provide PrEP. When it comes to discussing PrEP with a provider, a lot of adolescents will be hesitant to disclose sexual behavior. They have really significant confidentiality concerns. And then the provider that they're speaking with likely has limited knowledge about PrEP to begin with. And we also see barriers in terms of PrEP use. And so there's a lot of confidentiality concerns that can actually limit their ability to use their parents' insurance if they otherwise would for medical care. There's also challenges with the frequent follow-ups that we have, as well as challenges with daily adherence. So what we've done with virtual PrEP is that we are bringing a trained adolescent PrEP provider along with our really robust adherence support network, including PrEP navigators that help with both payment assistance programs and medication access, as well as daily adherence. And we're bringing that to the patient wherever they are within the state of California. And because we're doing these all virtually, we can do frequent and brief follow-ups. We've had follow-ups with patients in the middle of a fast food shift, in their backyard of their friend's house, a whole variety of places. But because we are more accessible, we're able to touch base with patients and troubleshoot any issues that come up along the way much more easily. When we look at the geographic reach, what we see on the left are the HIV diagnosis distribution in California, and the darker counties had more diagnoses. And on the right, we actually see our referral map. And so what's really promising with just, even though we're in the very beginning of the development of our program, is that we really are reaching areas that have the greatest need for HIV prevention. So thank you for listening to more about our program. If you have any other follow-up questions, I'd be happy to answer them. Just email us at prepadmin@stanfordchildrens.org.